is challenged on ABC's Good Morning America.
Now, yesterday, the government released a new report on smoking and health, which said that there is overwhelming evidence that cigarette smoking causes lung cancer and is a major factor in heart disease. The tobacco industry says that there is no conclusive evidence that smoking causes cancer or heart disease. Yesterday, we discussed this new report with the United States Surgeon General, Julius Richmond, and John Pinney of Health, Education, and Welfare. And this morning, Bill Dwyer, who is Vice President of the Tobacco Institute, is with us, and Steve Bell joins our conversation from Washington. Good morning, Mr. Dwyer.
Good morning, David. Thank you very much.
First of all, the industry, naturally, the tobacco industry wants people to smoke. If everybody quit smoking, then there wouldn't be an industry anymore.
We want them to be able to be free to choose. Right.
Make a choice,
right,
sure.
Right.
But if everybody made the choice to quit smoking, then of course there wouldn't, let's say, be any more tobacco industry. So it's in the interest of the industry to keep people smoking if they're going to continue to make a profit. Why should the public believe you as opposed to believing the Surgeon General and all the doctors and the reports from the government?
David, I don't think it's quite so much a matter of believing us versus someone else. It's believing what the facts are. And the facts shouldn't all come from a single source. It isn't really just our statement of contradiction or difference with the Surgeon General. There are many independent men and women of science who don't believe that the causal conclusion yet has been reached. David, we don't deny that there is statistical evidence. Smokers in greater number than non-smokers do fall victim to these various diseases. But we must remember that, for example, most smokers don't develop lung cancer, and certain non-smokers do as well. We think it's an open question.
Mr. Dwyer, Steve Bell in Washington, when you talk, though, about one source, as I understand it, you're not talking about one source. You're talking about the government compiling statistics from some 30,000 different studies done by all types of research people, and the government says that along with the people you cite, there is still overwhelming evidence.
Steve, the term overwhelming itself represents a judgment. There are differing points of view even within the expressions that are contained in the Surgeon General's report. Don't you think that there is perhaps a more fundamental question, or at least we do, and that is warning. The Surgeon General has determined there isn't a soul in this country, except perhaps a cave dweller, who could have missed that message. It's imprinted on the American awareness. At that point, our position is that individuals ought to be free to choose. Not children, by the way, adults. They've been put on notice, and whether it's aspirin or sweeteners or swordfish or now beer this week, as I heard you report, Steve, or pan-fried hamburgers last summer, there are so many incriminated items. We think Americans, after the information has been passed, ought to be able to come to their own conclusion.